The broadcast is now starting. All attendees are in listen-only mode.
Oh, there we go.
There's some people. Yeah.
Sorry about that, guys. Guess I was wrong.
Hi, everybody. We're really sorry that we started a little bit late here. We just had some technical issues, which hopefully have been resolved. So we are ready to get going here. My name is Naftali Serrano. I'm the Executive Director of the Collaborative Family Healthcare Association, where our goal is to make integrated care the standard of care for all. And we're happy to have you join us today for a really interesting and important topic on interprofessional education. So before we get to that, and I promise we'll get to Jody here real quick, just a few sort of housekeeping details. We do encourage any questions, but we encourage them through the chat feature. So if you can make sure that you are muted, that would be great. That way we don't have any interruptions or any background noise. And then if you have questions as we go, please put them into the chat feature. Jenna, remind me again, is it the chat feature or the questions feature that we want people to put their questions in?
I think you're correct. It's actually the chat feature rather than the question feature. I think the questions feature allows us to see questions, but not until after the webinar is over. So go ahead.
Got it. Okay. Yeah. So just like Jody just posted that she's back on, you do that. You just put your question in, and then Jody can answer as she goes, or wait till the end. The only other announcement I have is just to, if you're not part of CFHA, to introduce you to CFHA. Welcome. We are a group of interdisciplinary professionals from all sorts of healthcare stripes, from behavioral health to medical, to folks in the peer world, folks in the foundation world, anyone interested really in team-based care and integrating mental health, behavioral health, and the whole person. So that's what we're about. So please check us out at cfha.net if you haven't already. And while you're doing that, you can find links there to our news site, which houses our podcast. That site is integratedcarenews.com. And you can also find information about our upcoming conference in October. That is a must-attend conference. If you talk to any CFHA members, it's a great time. You can find information there at integratedcareconference.com. So now, without further ado, I'd like to introduce to you our presenter for today, Jody Polaha. Jody is a longtime CFHA member and champion. She's held many roles within our association. One of her interests is this area of interprofessional education, which is a really crucial role for the movement of integrated care, given that we want to start early with folks. Most of the work that's been done in integrated care, as many of you know, has been retraining established professionals. And that's a lot harder than really starting from the ground up, which is what this presentation is going to be about. So I'm excited to hear what she has to say. I hope you are too. Without further ado, we'll turn it over to Jody. Jody?
Hello, I'm here. Which screen are you seeing? The right one or the wrong one? Are you seeing my email or my phone?
Yeah, we're seeing your email, which I'm sure you're not wanting us to see.
No, that's my personal business right there. Yeah. Let me get this straight. Very good. I never know which screen it's going to be. Okay, so very good. Thank you for that introduction, and I will just move a couple things around here and get organized. I'm Jody Polaha. I'm on the faculty in the Department of Family Medicine at East Tennessee State University, and I'm also incoming co-editor for Family Systems and Health, which is a very exciting new role, and really getting to work on that has been very exciting over the last few months. Now give me a second while I advance this thing. Very good. I want to make sure and credit the people who have done the work on this project with me. My incredible colleague, Ivy Click, who's here in the department with me. We both work in the division for primary care research. And a little plug, Ivy and I just published a chapter in this book that you see in the corner, Practice-Based Research, which is a guide for clinicians who are working in healthcare settings and want to do innovative work and write about it. We have a chapter on primary care. I also want to shout out Brian Cross, who directs IPE programming at ETSU, and he and I have worked together for about 5 years coming up with the curricula that I'll describe a little bit today. He's been instrumental in this work, and then we have a bunch of other collaborators in pharmacy who work with us on this project. And so I'm going to talk about IPE kind of broadly initially, and what it really is, because I think in CFHA we have a lot of folks that are in healthcare. This is really something that's placed very firmly in academics, and kind of describe that just briefly, and then talk about what's going on in terms of current research in IPE. How do we know it's a good idea? How do we know it's working? And then talk about our study specifically. IPE, if you look, dates back quite a long ways. I saw citations dating back into the 60s, more momentum in the 80s, but really in the last 10 or 15 years, it's gained a lot more traction. And you see this quote a lot. What is interprofessional education? It's occasions when two or more professions learn with, from, and about each other to improve collaboration and the quality of care. I'll say that's the definition of IPE. It's worth noting that IPE is very distinct from training health professions who are already in the workforce to work as team members. So what I'll be talking about today is this type of teaching as it applies to students in healthcare professions. IPE has really taken off in many different ways. And one way you can tell that it's taken off is that it's written into accreditation standards for many health professions. This is an example of the accreditation guidelines for pharmacy education, which talks specifically about students needing to have competency in team dynamics, values and ethics, and then being trained in curricula that help them experience team-based work and kind of know what team-based care is about. And this is true not just in pharmacy, but in medicine, public health, many of the allied health disciplines like speech pathology. And I think I'm hearing that social work is building IPE competencies into its accreditation standards. So this has really spread within academia. There are a number of national organizations that focus on interprofessional education, again, kind of the student level learning about team-based care. Conceptually, if you wanted to learn kind of what's been kind of some of the seminal work that's guiding the development of pedagogy and thought around how you train, we're talking about, 19-year-olds at some of them, because they're coming out of undergrad and they're first-year social work students, or their first-year, I'm sorry, not 19-year-olds, like 21-year-olds who are coming out of undergrad, who are first-year social work students in a master's level program. Some of them are even younger. They're bachelor's level nursing students. So very young people. How do we talk to them about team-based care? This paper is one that I would refer people to, sort of a very off-cited paper that lays down some of the framework for how this work is done. It was updated in 2016. And one of the main things that came out of that paper were these 4 core competencies. And if you go to an IPE conference, everybody talks about how they've built these 4 core competencies into their IPE curricula, so that entry-level healthcare students, health professions students, kind of are getting exposed to specific skills and competencies around these domains. And I think they have it, I know they have it detailed in this document, kind of more examples of what competencies would comprise values and ethics, for example. But I'm not going to get into the weeds on that. I just want you to have kind of a sense of how the profession is developing or how the field is developing. And I think one of the ways to learn about that is just to hear about our curricula a little bit, kind of where it's kind of come from and going to. We started working on this curricula probably 5 or 6 years ago, thinking about how to get all of our health professions students engaged in interprofessional learning. We had a pilot program for a few years that looked very different from what we're doing now. We kind of learned from some of our experiences with that and kind of did a redo. And I'll tell you a little about what we do now. Our ECSU has a lot of health professions training programs. We have an academic health science center that has medicine, pharmacy, public health, nursing, a variety of allied disciplines. And then we also have departments of social work and psychology on campus. All of these students in all of these programs are involved in our IPE programming, almost all of them at the graduate level. Again, these are folks that most of them just came out of undergrad, with the exception of nursing. We actually have some bachelor's level students involved in the program. So we've taken those 4 domains that were laid out in that paper I mentioned earlier, and we've identified our own kind of tangible, measurable competencies that we chase after, that we try to teach toward and then measure. And I'm just showing you what we came up with for roles and responsibilities. So if you're a clinician or somebody that works in a clinical environment, you can kind of look at these and think, how essential are these things? Is it important to be able to talk about various team members that you might be working with and know what their roles are and understand their training background? Is it important to be able to discuss how roles can be flexible on healthcare teams, and different people can do things that other people can do and overlap and all kinds of things like that? Is it important to be able to discuss leadership as a team role, moving beyond just what your guild is and actually working to lead the team? Is it important to be able to practice the skill of articulating your own role, which we think is very important, just to be able to say, this is what I do in a way that makes sense to other members of the team? And then, of course, number 5 just talks about an important piece that we review in every one of our sessions, which is like rapport building with interprofessional people and strengthening relationships, and that kind of guides us as well. So these are 4 competencies really out of 5 that we've identified as super important things for entry-level students to learn. Our curricula teaches these 4 plus a handful of competencies under each of the other domains, total of 11 competencies, in the context of 4 half-day learning experiences. They're kind of long half-days, like 5-hour days. We bring the students in. The day is roles and responsibilities, and we focus everything that they learn that day on roles and responsibilities. And we bring them in another day, and we focus on competencies around team communication. We bring them in another day, it's values, you get the idea. So 4 of those, and then our students do some community-based experiences where they're actually looking at teams functioning in real-world healthcare settings and evaluating them-ish on some of our taught competencies and skills. So this is what we're teaching. How we teach it, again, we bring these students in, and our days almost always start with some sort of experiential learning. A couple of good examples here. This is a puzzle, and the students all have a role that they have to play in building the puzzle, but nobody can see anyone else's role, which is very similar when you think about it to how sometimes it goes in real-world healthcare settings. You think you know what the other person is, their role is, but they actually see their role differently. It generates some very interesting conversation. Another one here on team building, I won't get into the details. The point is that they get to experience some of the concepts around working in a team, roles, values, etc., outside of specific healthcare application. We do quite a bit of discussion and debrief. The students really think hard about what these ideas mean. They apply them to clinical ideas in concept. We do some didactics. And then they do a lot of simulation and get a chance to see some modeling. This is one of our groups. The whole cohort is broken up into groups of 8 to 10. They have every different profession represented in this room, plus 2 faculty from 2 different professions that are their mentors. And what you see here is one of the students interacting with one of our standardized patients. Only thing here, she's functioning as a standardized healthcare provider. So maybe they're practicing some conflict-based communication, crucial conversations type of a role play. Here is another example of a team-based interview. You have a pharmacist, nurse, and medical student facing 2 gentlemen on the right. Those are the standardized patients doing an interview and they're following a checklist of team behaviors, introducing one another, talking about what the team is and why they're being seen by a team, helping patients understand their roles as a team. We do, again, a lot of debriefing and discussion after these experiences. This is one of my favorite slides because the standardized patient on the left-hand side in the checkered shirt is my mom. She's a standardized patient in our program. Again, a lot of opportunity to just provide new knowledge as well. So that's the curricula. The question is, like, how do we know if this is helpful? These people are coming to us right out of undergrad. They think they want to be a medical doctor, for example, and what they have in mind is really nothing to do with what we're teaching in this curricula. And, you know, they're learning this stuff in a very academic-y way. And even though we try to do lots of application, these are students who are not even in a clinical context, haven't ever seen a real patient, haven't even shadowed someone who's seen a real patient. We do these 4 days over the course of the first year that they're in medical school or pharmacy school or a psychology program. And so, you know, how much they get out of it. Well, another really seminal paper that was published in 2015 talked about how to measure the impact of IPE on collaborative practice. One of the major points that came out of that paper is number 1, that, you know, we need to really measure and be sure that what we're teaching healthcare professions students has good alignment with what's really needed in healthcare delivery systems. And yet that's really not what you see a lot of times when you look at IPE programs. They're very theoretical and abstract and removed from meaningful work in clinical settings. This paper had a number of other recommendations, which you'll see on the screen. Number 3 is worth mentioning. This paper put a lot of emphasis on the need for evidence around the impact of IPE on real-world outcomes, which I think is a great point. But the problem with foundational learners, like I'm talking about, brand new people in these health professions programs, is that they're not in a clinical context. So you can't measure their impact, the impact of the training on any kind of thing in any kind of real-world setting. And what's happened is that measurement of IPE programs has relied very heavily on rating scales and self-report. So, you know, at Likert Scales, asking students about their attitudes toward team care and their, you know, attitudes towards interprofessional education, paper and pencil measures like that. And the bottom line is that it's pretty meaningless. And there have been some calls in the literature to try to do something more creative with these students and get at behavior rather than just attitudes and beliefs. So that was kind of the background. I'll tell you a little bit about kind of, I knew all of this. I was very challenged by this. We collect our own paper and pencil measures on our curricula, which is fine and dandy. But I wanted to be the person to, like, you know, push this study and research a little bit beyond where it had been. And I was giving a lecture one day, and at the end of the lecture, this medical student student came up to me, and he was finishing our IPE curricula. He had done our IPE curricula. He'd also spent some of his third and fourth year working in team-based care and pediatrics, which is a model that I developed over years. And he went to me and he said, I'm going to set up integrated care on my residency. I just need to find out how to do this. Where do I find out how to, they don't have it there right now. I've already interviewed, and they don't have integrated care, but while I'm a resident, I'm going to get it rolling. And he was using pretty sophisticated language to talk about business plans and kind of how he conceptualized it. And I thought, of course, it was a winning moment for me, because I was like, man, I got this young person to apply for a position and now go out and do something different. This is exactly why we do IPE, right? Like, this is the outcome. Maybe even more so than a specific clinical skill. It's the inspiration and moving people to go out and do something in healthcare that they maybe would not have thought of or done. So I'm thinking, like, how do you measure this, right? Like, this is just the coolest thing. And I came up with the idea that we could create or do mock interviews with students. Like, we would just tell them that we were going to interview them for a clerkship position, and we could ask them a bunch of questions and see if they talk about IPE, and see if they talk kind of like this medical student was talking. So that's kind of the inspiration behind the study. So the first question we asked was, if we do a mock interview with students that are finished with that are past the IPE curricula, kind of at the end of their second year, do IPE students spontaneously incorporate the content that they've learned in the IPE curricula into their interview? Do they talk about team-based care? Does that kind of rise to the top of what they would say in an interview? And does that differentiate them from non-IPE students? Our non-IPE students are learning about team-based care too. It's a little bit more catch as catch can, but you can't, team-based care is becoming pervasive enough that all of our students are hearing about it. Does it really matter that we're spending 4 half days with these students and putting them in some clinical environments for brief periods? Is it changing the way that they respond in sort of the real world? And then we also kind of wondered, well, if they do say a whole bunch about their IPE experiences, their value for team care, they talk about some of the things they learned, is that stuff even what the interviewer even really wants to hear? Do real world clinicians who maybe would be interviewing them for a job someday want to hear those things? Are the things they're saying based on our programming appealing? And does that discriminate them from their peers? Does IPE programming give them an advantage in the eyes of a real world team-based clinician? So kind of two questions. I'm going to walk you through one, and then we'll kind of come to the methods for two. We interviewed 10 IPE graduates, right? They had taken our IPE curricula, 5 from the pharmacy school, 5 from the medical school. We lost a couple of things in transit between non-functional, recording devices and whatever else. We ended up with 4 and 4. And we also interviewed 10 non-IPE students with the same kind of numbers in the end. We interviewed them at the end of their second year, after they had completed, half of them, right, had completed the IPE curricula. And we totally deceived them regarding the true purpose of the study. When we recruited them, we had people not associated with the IPE program recruiting them in their classes. They never saw me. They never saw any of the people that are involved in IPE at any point during recruitment. They did not see us in the context of participating in the experiment itself, which was, coming in for this interview. And we gave them an informed consent that just said, we just kind of want to learn we want to know what our students have learned to this point in their curricula. And we want to find out more about how they do in an interview, and we're going to give you some feedback on your interview skills. And as far as they knew, we were asking them about everything that they had learned in the last 2 years of being a pharmacy or medical student. There were no cues in the environment at all to the contrary. So that's how they came in. After they completed the informed consent, we handed them this ad for a job, and we said, this is the job you're interviewing for. It's a good vet health services, integrated healthcare delivery system. Talks a little bit about multidisciplinary team, and otherwise just throws a bunch of other sort of phrases out there. Provide a complete range of services, passion for building healthier communities, always world class, right? Always compassionate. So this is what they read. And again, there's the word integrated in there. There's the word multidisciplinary. Those are not words we use a lot in interprofessional education. We tend to say collaborative practice, team care, and words like that. So actually, and it does say team care. That's the only place where it really has a tip off there in multidisciplinary. But otherwise, it's just kind of an ad they read. And then they sat down in an interview where they were asked these 3 questions. And the first question has nothing to do with anything. Just why are you interested in this position? And what skills do you bring? The second question was, you see that we're using multidisciplinary teams. What do you know about team-based care? And then the last question really just in case we didn't get anything, we asked them if they had interprofessional training and why they thought that would make them a stronger candidate. So the questions did get more targeted to kind of drive the responses we were looking for as we moved through. But again, we started out real broad and then asked more and more specific questions. About 20 minutes per interview, and we kind of timed an interviewer, and she followed some specific prompts and kept things fairly standardized. So let's just talk about aim 1. Again, aim 1 was just to find out if the students expressed the competencies that we taught them. So we taught them these 4 specific competencies around roles, for example. Did they even talk about any of that stuff in the interview? We had 3 research staff score transcripts using a Likert scale with all the competencies listed out. So for example, discussing leadership as a team role is one of our competencies. And we scored them either 1, no, the student did not mention leadership as a team role at all the way up to 5. The student talked very specifically about, evidence for specific steps to do it or skills needed to be a leader on a team. And we all did that and had very high inter-rater reliability, which I'll show you in just a minute. What you can see in this table is that our IPE students were significantly different from our non-IPE students on these specific competencies: communication, teams and teamwork, roles and responsibilities, and overall. The only one they did not differ on was values and ethics. So we showed basically here that they talked about the things we taught them and discriminated themselves from students who had not learned that material. So here's the specific number for inter-rater reliability, which was 0.82 for the 3 of us that were scoring each transcript. Again, the IPE group did better. There were no differences between medical and pharmacy students. So you can kind of see here that on the whole, our students scored about a 3 on these competencies out of 1 to 5. And if you think back, the Likert scale, in fact, I'll just take you to it. The Likert scale is 1 to 5. So mostly our IPE students were mentioning the things that we taught them, but not elaborating on them. And that differentiated them from students who had not had IPE, who didn't even mention them or barely mentioned them, right? So we also had this procedure for seeing what real-world clinicians thought about the things that our second-year medical and pharmacy students were saying. We actually used CFHA a little bit here to recruit some experts. These were 4 medical doctors, 4 pharmacists, 4 behavioral health providers. All of them spend a lot of time in team care practice, at least 25%. Many of them spend 50 to 100% of their time doing team-based care. None of them are academics. None of them are involved in IPE curricula. They wouldn't necessarily get tipped off to as to the purpose of the study. So, or start looking for things, I guess is what I was thinking. They each reviewed 4 transcripts. So they reviewed 2 IPE transcripts, one from medicine, one from pharmacy, 2 non-IPE, same kind of division. And again, we kept them unaware in terms of the true purpose of the study, assignment of groups. They had no idea that we were studying the impact of some sort of programming. They didn't know that half the students' transcripts were students that had completed an interprofessional education program. They didn't know really what the heck we were doing. I think we had told them that we were just studying students' values around team-based care, and that's all they knew. This is a lot on this slide, and I apologize for that, but this was how we asked clinicians to weigh in on these students. First, we had the experts read the transcripts and highlight phrases they thought suggested training values or skills in team-based care, and we're in the process of analyzing that using more of a qualitative approach. So in talking further, I'll be focused on 2, 3, and 4. We had them rate the students on 3 questions. We asked them, does the student have values around interprofessional education? Does the student seem to have values around team-based care? And does the student seem to have specific knowledge and skills in team-based care? And they rated them on a 5-point scale. They also responded to a question, yes or no, do you feel like the student had specialized training in IPE, in interprofessional work, collaborative practice models of team-based care? So they're just telling us whether they felt like the student had some training. And then in a separate process, and they did not know, each one of these was revealed separately in the instructions. So the last, number 4, they did at the very end, all of 2 and 3 for all of the transcripts. We asked them to rank the 4 students in terms of who they'd be most likely to hire as part of team-based practice. So number 1 to the most likely or most preferred down to number 4, the least preferred. And again, they had 4 transcripts in their hand, 2 IPE, 2 non-IPE, 1 of each medicine and pharmacy. So just talking about the ratings on those 3 questions, you can see that this group that got IPE, which is the group that's called the treatment group on this chart, had much higher scores, and they were clinically or statistically significant. And no difference between medicine and pharmacy. This is the question, did this participant have IPE? Again, the 2 bars on the right are the IPE group, and the 2 bars on the left are not IPE. So when they were reading a non-IPE student's transcripts, they weren't really sure if that student had any particular special training or not, 50-50, right? But when they were reading one of the IPE students' transcripts, they knew. And that's because the students talked about it, right? It was very obvious. So they did a much better job of discriminating that group. And then this one's also quite lovely. This is where they rank ordered the 4 transcripts that they had as 1st, 2nd, 3rd, 4th. And what you see here are the red bars, which are the IPE students, getting ranked number 1 and 2 at a much higher rate than the non-IPE students. So they're seen as more preferable in terms of their skills relative to the other students. I'm going to skip this slide just to keep things simple. Here are some examples of things that students said in the interview. So this one relates to leadership as a team role. A student said, like for instance, if a child came in and they showed signs of abuse, a lot of times a physician might say, well, I think the psychologist needs to take the lead today. So I think everyone recognized their value, and people really worked well relying on one another, and I think that is the best way to care for patients. I think there's also a value in that statement. Another one that relates specifically to values, I think that at the end of the day, you come back to, I'm here to help people. Then you're better at communicating with other team members because you realize what the end goal is. And I think I really connected with that message, and that is what helps me to be a great team member. And I just want to also make the comment that a lot of our responses were, for our IPE students, were often right out of the gate. So the very first question, what interests you in this position? That it's an interdisciplinary program, and I think that typically healthcare performs better when pharmacists and physicians work well together, and I think that is something we should implement more. And we got a lot of responses right out of that first question. We actually talked about the value of just having our clinicians score that first question, because so many students talked about their IPE experiences, their IPE training, their values for team-based care, just when asked, what interests you or what skills do you have? They seemed to see those skills as more valuable, or I should say a unique aspect of their resume that they could pitch. Okay, so just a couple of conclusions. I skipped over this slide, and then where it was in my talk was confusing, so that's why I didn't go into detail. But our results when we looked at the competencies was that our IPE students scored higher on 7 out of the 11 competencies. 4 of those were our roles competencies. And I don't really know why that is. Like, they got it for all the roles. They talked about all of the roles, but they were about half and half on communications and values and teamwork. They did have the roles curricula. The roles piece of the curricula was the last day. So it could be a recency effect, but we did this interview process in late April, and they hadn't had an IPE day at all since January. So this was all from memory. Some of it going back at that point close to 2 years since they started the first IPE day. So I think it's impressive that they were still building in this content as they were talking about their skills and abilities. Again, I said this earlier, our scores on the competencies were just above the midpoints. Like, they really weren't recalling in detail. Maybe we taught them the acronym from Team Steps for Crucial Conversations, which is the DESC acronym. They didn't talk about that. And they didn't provide a definition for social determinants of health, for example. Some of the very specific things we taught them that would have earned them 5s, they just brought up a little bit more generally or broadly. And so their scores were mostly right at the midpoint on a 5-point Likert scale. And the other interesting thing is that the groups really weren't differentiated in the area of values, and I'm not sure why that is, if it's just too intangible of a topic, not as concrete, or perhaps team-based care is something that is valued institution-wide. So by the time you get to the end of your second year, you've heard about it in enough places that you value it, even though you didn't have a specific curricula in that area. So we're not sure. It's interesting. The fact that we got these data from clinical experts helped us demonstrate some external validity for what we're teaching, what our students know about when they get done with the course. And I think it's really important that students are learning to at least be able to talk about the concepts that are viewed as important in the real world. And what happens with a second-year medical student or a second-year pharmacy student or even a second-year psychology student in clinical psychology is that the following year is their third year. They go out on clerkships or externships or fieldwork placements where they actually get to see team-based care, hopefully, right, on a day-to-day basis. And kind of coming into those environments oriented like this, I think is really important. And being able to talk about it, even if you don't necessarily know how to always introduce yourself to other team members and you don't have the skills down exactly, the fact that you know what you're looking at and you value it and you can talk about it in a sophisticated way, I think is very important. And so one of our clinical experts said this: students were able to talk in a way that showed that she had actually internalized, valued, and accepted the essence of team-based care. Instead of focusing on her clinical skills, she focused more on the key ingredients to team-based work: likability, flexibility, openness, enthusiasm, willingness to adapt, work, learn, relearn, communicate easily and effectively. You can train the other skills much more easily than you can help someone become a fluid part of a working team. I thought that was a really nice bit of feedback from one of our clinical experts and kind of explaining to us why she chose who she did for a future hire. The purpose of the study and wrote to them by email and said, we didn't tell you the whole purpose of the study. What did you guess anything? Did you think it was about anything more than maybe you're trying to study whether your classes are effective or something, which is getting there, but nobody gets. So I think I covered all the points I wanted to cover. My contact cohort, where they completed a knowledge and attitude measures before the curricula, and so did controls. And it'll be the first study that shows attitudes and knowledge change in self-report form compared to controls. So we just followed up with them 2 years after completion. We also followed up with our control group, and we have the data all analyzed, and it shows beautiful differences between the two groups. Not different at pre, but different, very much different at post in terms of the impact on, again, knowledge and attitudes. It's just a paper and pencil measure, just kind of replicating what we have seen in other studies, but other studies have not had a good control group. So that will be another contribution coming out of this program. And that's all I have. So thank you all for joining me on your lunch break. And I think I'm looking at the text box to see if there are questions, but if there are questions, I'm happy.
There's no questions yet, but if there are questions, please put them on. Jody, I did have a question myself. Yeah, first of all, great. I mean, it's just so exciting to see this happening so much earlier on for those of us who have worked so hard retraining folks later on. So the idea that you're making headway at showing that this sort of interprofessional education actually works, at least attitudinally and in the content of what they're talking about. I'm wondering if the folks who work in IP, what would they say about helping students navigate the socialization process that they will go through as part of their discipline programs, sort of navigating the tension between what you're trying to teach them in IPE and perhaps some of the socialization, which may or may not jive well with that approach. What would folks in your world say?
That's a really interesting question. We actually do a really fun exercise with them on roles, and we do roles and responsibilities last, and we do that on purpose because we know that if we do it first, folks will be really hung up on stereotypes and not be able to think very flexibly. By the time we teach roles, they've been together in these small groups for a couple of years, and they really like each other, right? And they get to know other students and other professions. And we do this implicit bias thing where they look at photos of healthcare providers and they answer questions about them. And it's amazing to see how many biases they come up with, a lot. So, I mean, I think we're going to be constantly sort of counteracting a culture that's teaching them something different. I don't know that we've ever tried to inoculate them from that explicitly, other than, I know our faculty in debriefing sessions will say, now you all aren't going to see this in the real world, so if you want it to happen, you have to go out and do it. So preparing them for being the first ones to try it, or being the first ones to do it, or being the first ones to kind of step out and be different. It's very interesting when they're in these crucial conversations, role plays, because they have to face off with an actor who's playing the role of another care profession, and we try to build hierarchy and stereotypes into those role plays. And so they're actually sort of, I kind of wonder if that's a little bit of inoculation as well, kind of forcing them to rehearse their role in a different way. It's a great question. Yeah, I see on the screen too. We do use some team steps, like we use the DESK acronym. I didn't put a slide in here. I should have. We got quite a few tools, not everything, but some from the Nexus. It's the National Center for Interprofessional Practice and Education, and they have a website called the Nexus, and there's a place on that page where they have a toolkit for precepting in the Nexus. And you can literally Google Nexus Preceptors Toolkit. You have to join the page, it's free, but that little toolkit has like all kinds of standardized patient roles worked out. It has some like PowerPoints that you can take on, say, for example, values and ethics and adapt. And it has some little video vignettes that we show that show like functional and dysfunctional teams. The students watch those and they're fodder for conversation. There's a wealth of stuff on that page. Okay, so we have only had about 60 students per year, which is 10 medical students, 10 pharmacy students, and then a smaller number of students from the other disciplines. The days were not consecutive. There were, it's changed a little over the years. How it has been the last couple of years is 2 of the sessions are in the fall. So like there'll be a September Thursday afternoon, 12 to 5, and then like a November Thursday afternoon, 12 to 5. And that would be like values and ethics and then communications in November, and then 2 more sessions in the spring. We use a lot of standardized patients. I think we have to have sometimes 8 or 12 of them on site to do some of the work that we do. We have an amazing standardized patient program. I don't know what it costs because I don't run the budget for this program, but our folks seem to be happy to pay it because they do a great job. And we need them. And frankly, you know, we have, I could have put this on the screen, we have really cool data on the students' response to the program. We ask them element by element. So what did you think about this lizard puzzle task? And what did you think about this conversation about blah, blah? And we ask them about the standardized patient interactions. And the standardized patients always are the most highly rated aspect to the program. I think we kind of know that this may be like a less preferred activity, or they don't really know what this is about. And so building in, real world role plays and doing those standardized patients, making it feel real, like, wow, I'm getting to practice interacting with real patients, helps us with buy-in. We are rolling it out to our entire, we will have all medical students, all pharmacy students, and a much larger sample from the other schools starting this coming fall. We're going from 60 to over 300 students in our IPE program, so it'll look and feel a little different. Recommendations for using alumni or other individuals on, yeah, sure, absolutely. And actually, we have had, the question is like, how can you supplement if you can't pay for standardized patients? We've actually had our students just role play some of those things, so you can do it totally free. I will say they think it's a really big deal to interact with the standardized patients. It really does. And our standardized patients are amazing actors, right? So they cry when they're sad. I mean, like if they're injured, they look hurt, they're in pain, whatever. It's just very cool. So I think it's worth investing into that, but I definitely think you could do it without that. Do students self-select? No. For nursing, pharmacy, and medicine and public health, it's a lottery system. that we randomly pull numbers and then offer slots to students. So they can turn it down, but we don't like start with the brightest students or start with the most motivated students or ask them broadly who wants to do this. We work through a list. So it is a random selection of students. Now, like psychology only has 4 or 5 graduate students a year, so they all do it. Those are great questions. I think I got them all.
Very great questions. If I can squeeze in one more question, dovetailing on that. Sounds like you're growing the program tremendously. Have you had any departmental pushback, or is everybody on board with the IPE mission?
There's a wide span of space between pushback and on board. And so like our IPE leaders, for them on board means like you're committing faculty time, because we need like 35 faculty now instead of 12. You're committing maybe some funds toward some of the program costs. You're willing to change your schedules around so we have, a consistent time to offer this, where all the colleges and schools are letting their students out of a class or don't have class, etc. There's a lot to give if you're on board. And I think we're making steps. What we really want is colleges to start giving people FTE to work on the development of the program, to get involved in faculty development, to get involved in building IPE work into other aspects of the curricula. Like, we really want it to spread. And I don't think we're quite there yet. But I think it's a big deal that at least pharmacy, medicine, and nursing have committed huge cohorts, have moved their schedules around, and have committed faculty to do the training. And the other programs are smaller and have been committed to providing some students. So it's just a process.
Yeah, absolutely. But that is also tremendous progress. So congratulations on that and on this initial study. This is tremendous.
Super fun.
Thank you so much, Jody, and thank you all for attending today. We really appreciate your attendance. If you want to hear this again or reference it or share it with others, you can check our Vimeo channel, which you can find linked on our news site, integratedcarenews.com. We'll have this up probably within the next couple of days, and then you can scroll down to the videos section of our news site, and you'll be able to find this and send it out to all your friends who love IPE and team-based care. So once again, on behalf of Jody, I'm Naftali Serrano. Thanks for listening. We hope to see you in a month for our next webinar hosted by Patty Robinson. So keep an eye out for that one as well. Have a great rest of your day, everyone.
So long, everybody.